For more on the exploding market in home health tests, I spoke with Julie Fischer. Julie is an associate research professor at the Department of Microbiology at Georgetown University. And I began by asking her about the leading companies in this industry.
Clearly, there are companies that have been conducting or overseeing home testing modes for a long time, particularly those that work in the areas of diabetes and work on providing testing for diabetes care. So those have a really well-established track record. Others, there's just a proliferation of companies in this field, and really in just the past few years, it's just blossomed. You see hundreds of companies that are offering at-home testing directly marketed at consumers.
And we're certainly seeing things like fertility testing, we're seeing things for food sensitivity, other people just really want to know more about their past history. Are there certain sectors that are gaining more popularity than others?
Well, some of those are very well established. So, for example, the fertility testing, it's based on similar technologies that have been used for decades. We're all familiar with some home tests like pregnancy tests that are frequently used by consumers, purchased over the counter, used directly at home. But what we're really seeing now is a growth in areas like food sensitivity testing, allergy testing, management of chronic diseases, and that's partly because we're just seeing an increase in the amount of chronic disease in the population worldwide. So there's a lot of interest in being able to monitor one's own health at home and being able to screen for conditions that may have no symptoms, and that it's useful to know ahead of time if an illness is there or a predisposition is there, so that the person can take charge and learn what they can do to prevent themselves from becoming ill.
So with more consumers really taking a more proactive role in terms of advocacy for their health, in terms of expectations, what should they keep in mind when it comes to these sorts of tests?
I think the most important thing to keep in mind is that the tests have different levels of reliability. When you are using a commercial laboratory or a hospital laboratory to provide testing at the advice of a doctor, that laboratory has to pass quality testing on a very regular basis, and the oversight tends to be very stringent. When you're looking at home health tests, some of them are validated by the Food and Drug Administration, the FDA, and based on well-established technologies. Some of them are really just shortcuts in which the consumer collects a sample at home and then sends it off to a lab that does have that quality oversight. But some of them are being either read at home or sent off to new healthcare or laboratory testing services that don't have that degree of oversight, and the test may not even be approved as being reliable. So it's really a matter of the consumer, being very conscious that the tests that are out there on the market are not all equal.
And we certainly see that some states actually don't let you be eligible for this. You have to kind of go through your doctor instead. So can we expect to see more oversight in this sector?
I think as there's a proliferation of companies, we can certainly expect to see more oversight. At the federal level in the U.S., the regulatory pathway is pretty clear. The FDA regulates, oversees, and clears tests as being reliable for home use. At the state level, though, there's a lot of concern about what people will do if they use these tests and don't entirely either understand what to do with the information, or the risk that they could use them incorrectly and have a false sense of either confidence that they are free of a disease for which they've screened themselves, or make themselves quite anxious and worried, and often end up incurring the costs all over again if their doctor chooses to repeat the test when they go in to discuss these results. So I certainly think that we can see states becoming much more conscious of the risks and more sensitive about how to make sure that consumers have choice without putting them at risk of being either exploited or of coming up with results that don't help their healthcare choices.
Now, do you see this potentially being a wake-up call for Big Pharma, or perhaps even for these insurance companies, about including more preventative care, especially since they're seeing the popularity of these things? Or do you think this is primarily going to stay within the private sector? I think these startups.
I think that we can see that some startups have become quite established and become household names through offering these home kits. Everything from the kits that allow one to screen whole genomes for common markers of genetic ancestry, to predisposition to disease, to very specific conditions. So I think what we're seeing is partly a reaction to insurance costs and the desire of consumers to manage their own insurance costs. And this is certainly something that more and more clinicians are having to manage in their own practices. When a patient comes in and says, I have conducted a test and want to discuss these results with you, or I'm seeking a specific treatment. So certainly insurance companies are going to have to figure out what this means and what's covered. And clinicians are going to have to figure out what to do with consumers who are going out and seeking their own testing and their own results. But on the other hand, home testing can also be an amazing way to manage costs, particularly for chronic conditions. And even more so when the tests are FDA approved, when the user can be counseled in the doctor's office on how to use them correctly, and when the information can be shared for efficient healthcare. So that's actually a huge cost saver when those are incorporated effectively into a plan of healthcare.
So essentially more so working as a partnership as opposed to them just kind of working independently of each other.
Absolutely, absolutely.
So as we look at where the market is now, just how valuable is this home health testing kit market and how much room is there for growth?
Globally, that has really increased in the past decade to more than $25 billion worldwide now. And I don't think that is the limit. There's certainly an interest in finding tests that can help people with more chronic conditions, whether it's heart disease, kidney disease, high cholesterol, monitor their own health at home and share that information in real time with their healthcare providers. And as the technology has enabled that kind of information sharing, the tests that can be added onto smartphones, that can be conducted in a home quite reliably, it's just growing and growing and growing. So that's going to be a growing sector. And as we deal worldwide with aging populations who have the need to manage chronic conditions, the demand for those tests is still going up.